First of all, if you see me crying, it's because I have hay fever, not because I'm emotional. Secondly, I had 2 daughters at home, and I'm used to talking while they eat. So if you want to continue to eat, please eat. And I don't mind if you talk to each other. I'm used to it. But I'm Ronald Lauder, and it's my great pleasure to welcome all of you today to the 3rd Melvin Goods Prize Luncheon. My brother Leonard and I thank all of you for being here today with us to honor the vision of Mel and Nancy Goods, who created this prize, and to celebrate this year's recipient, Dr. Roberta Diaz Brinton. This prize was established to recognize the men and women who are working to make a lasting impact in the field of Alzheimer's drug discovery. Goods Prize winners are obviously at the top of their field, but there is something else that sets them apart from all others. They don't accept the status quo. They just don't follow established ideas. They question, they push, they're creative, imaginative, and bold. Those are the traits that will define success in any field, in science, in the military, and especially, as Len and I know, in business. We learned this a long time ago, and we've seen it play out over and over again. You've heard me say this before, that memory is what makes us who we are, and when we lose memory, we lose ourselves. We're here, but we're not here, and that is tragic. Many of us in this room has seen this happen to someone we love. That is why this work and these prize winners are so vital to finding a cure to this devastating disease. It is that in that same spirit of innovation that led my brother and I to found the Alzheimer's Drug Discovery Foundation 19 years ago. We saw that the status quo in Alzheimer's research was getting us nowhere. We knew there had to be a better way. I think we were right. There are more now than 120 drugs in clinical tests, and the ADDF, through their work, have put together 20% of them. Because of ADDF's investment, the pipeline of drugs are diverse and filled with promising new ideas, all pioneered by brilliant scientists like Dr. Brinton. I want to share a quick story with you. Several years ago, I was talking to a cancer researcher in San Francisco. God knows why I was in San Francisco. I asked him, what was the hardest part of his job? I was surprised when he told me that it wasn't doing the actual research. He really enjoyed that. The hardest part of his job was writing grant proposals. He said, if I could just spend that time doing my actual research, I think I'd be way ahead. That is where the Goods family and all of you came into this story. Because of the generous donors like Mel and Nancy, we were able to unleash these scientists from the time-consuming paperwork and let them do their real work, which is finding a cure. I'm sure all of you know that Nancy isn't able to be with us today because of the hurricane in Florida. I'm happy to tell you that she and Mel are safe and settling back into their home in Palm Beach after being evacuated last week. Nancy sets an example for all of us through her leadership, her generous philanthropy, and her commitment to ADDF's mission. We are so lucky to have her on our team. We're also very lucky to have Mel and Nancy's niece, Rachel LEEDS, here today to deliver Nancy's remarks. Rachel is not only a member of the Goods family, she's also a member of the Lauder family. Rachel is an assistant manager of the Estee Lauder companies. It's now my great pleasure to introduce her to you. Rachel, please come on. Welcome.
Thank you. Thank you for that introduction, Mr. Lauder. I'm honored to be here today addressing you all. This is the speech that Nancy was going to give. I'm going to deliver it on her behalf. Hello, and thank you for being with us today. I'm especially grateful to have so many members of ADDF's founding family, the Lauders, here with us today. Welcome to you all. This is our third awarding of the Goods Prize. My custom at this event is to give you an update on Mel's health. For those of you who ask, how's Mel doing? The answer isn't readily found in the responses we typically use for that question. Mel's life today is a mosaic of tragic and tender moments, many of them long predicted, and others both surprising and affirming. If you ask the man himself, Mel will respond in that legendary Tony the Tiger voice, "Fantastico, I'm doing great," just as he did when he walked the halls at Warner Lambert. That response, though, doesn't match the reality. Mel's health continues to decline. He is moving into the third and final stage of Alzheimer's. At times this past year, Mel has lost his ability to walk. He uses a wheelchair on occasion. He's taken to it graciously, but for those of us who remember Mel as larger than life, the sight of him in a wheelchair is very hard to accept. For me, the effects of Mel's declining abilities have been intensified by another tragedy, the death of my mother, Marion, from Alzheimer's, just after the awarding of the last Goods Prize. Death is never easy, but my mom's was especially wrenching, particularly in the final days when families are asked to make decisions no one is ever fully prepared to make. Challenging as this year has been, we are grateful for all Mel gives us. Like waves that erode the sand but leave the rocks, the anchors of Mel's character continue to stand out in sharp relief. He radiates love in all the ways he can. He is usually in good spirits, optimistic, friendly, happy, and completely at home in his element. He responds well to physical therapy and exceptionally well to music therapy, where the lyrics of his favorite songs stand tall against his disease. On Monday afternoons, his music therapy session, our household is happiest with Mel singing at full tilt. Mel also has a new pet. A feral kitten, now named Blackie, showed up at our door and we took her in. Mel intensely disliked cats. He has solved this dilemma by treating Blackie as a dog. When he calls to her, it's, "Here, doggy, doggy." He's taken to his newfound friend and vice versa. In terms of communication, Mel's ability for sustained logical conversation is gone, but he routinely asks questions that echo the ones he asked throughout his business career. He inquires, "How is our team doing? How is the project going? Are we succeeding?" We assure him that his team is doing well and that we will always make him proud. And from time to time, Mel says something that perfectly captures the moment. A few months ago, Mel asked why pictures of Donald Trump were constantly on TV. I told him Donald Trump is President of the United States. He looked at me with wide eyes. "President of the United States? No shit." Those moments are too few, but they are greatly cherished. If two words could summarize Mel's life this past year, they would be help and hope. This year, more than any other, Mel has learned to accept help from others. He's taken that lesson with grace and gratitude. In terms of hope, Mel, if he could, would tell us to keep hope alive. No one, as he said many times during his career, will follow someone who shows no hope. Given that relationship between help and hope, I know Mel would be most enthusiastic with this year's Goods Prize winner, Dr. Roberta Diaz Brinton. I've known Robbie for some years now and worked closely with her on the ADDF board. Our first female awardee, she's an outstanding scientist and scientific leader. Moreover, she's also been out in front in addressing the topic of Alzheimer's and its heavy burdens on women. As many of us have learned at firsthand, this disease takes a great toll on women, both as patients and as caregivers. You'll soon hear much more about Robbie, and you'll hear from her. But what struck all of us who know Robbie is her infectious optimism. She embodies the confidence, the hope that scientific achievement will lead to breakthroughs. That hope must be nourished with our help. If Mel were here, he'd remind you that while biomedical science won't be able to ride to his rescue, it must ride to our rescue. The rescue of hundreds of millions of people now in or approaching the danger zone for Alzheimer's. We can't give up hope. We need to double down in supporting the work of scientists like Robbie and keep pushing forward the frontiers of science and treatment. Through ADDF, we can do it. I ask you today, let's keep matching hope with help. Thank you. Now I'm happy to be able to introduce Leonard LAUDER. He's been a true friend of Mel and Nancy's for many years, and I know Mel would be honored by both Ronald and Leonard for speaking at this event. Mr. LAUDER. Thank you so much.
Hi, everybody, and thank you, Rachel. That was a great introduction. And look, we're all so happy to be here to celebrate the Mel Goods Prize and Robbie as our awardee. But I have to tell you a few things. Number one of the challenges we've faced over the years, because this is such an elusive disease, is that many diseases, such as breast cancer, which I'm deeply involved with, have no survivors. However, everyone in this room is a survivor, and it's our job to protect the people today and the people who are coming after us to make sure this disease is addressed and attacked. I have to quote something from Robbie, and Robbie, forgive me, I steal all the good words. She said, we can't say we would like to win this battle. We must win this battle. That is what we have to do, and that is our mission. And Mel was our champion. I first met Mel, I think 7 or 8 years ago. I met them in their house in Johns Island in Florida. And we sat down to talk and came up with an idea. And that is, look, rather than simply throwing money at it, let's find one target drug that's stuck in phase 2 and can't get out of it because of money, and let's support it. And that's the drug we supported. And Mel was put on trial there, and it turned the clock back. Not permanently, but for 5 years, there was a new Mel. That told me one thing which gives me reason to be confident and hope. And that is, if we can turn the clock back, on one person by 5 years, why can't we turn the clock back on all of us? And that's why we're here, and that's why Mel is my hero. Some of you may not know that Mel was one of the leaders when he was head of Warner Lambert Pharmaceutical in the work on Alzheimer's. He launched the first drug called Cognex. He was the one who put all of his assets behind Lipitor, which he knew would save lives. Mel is our hero. And in truth, everybody, all of you here are my heroes, because you're the ones who don't say to me, as many people say, look, you can't cure this. Why should I put the money in? Or why should I find out whether I have it or not? It can't be cured. It will be cured. Now, I will give each and every one of you a written guarantee. But you can cash in at the bank of your choice. We will cure it. The work that Howard FILLIT and his team are doing, and the work that our scientists who are on our board are doing, is so thrilling. Do you know, for example, Howard had done his first work at Rockefeller University. When he arrived there, Alzheimer's wasn't in their list of things that they worked on. Howard is the one who started them, and today, the work that's being done in Alzheimer's around the world is because of Howard FILLIT, and the man who gave us our jump start to help us go to the moon was Mel Goods. So let me, if I can, is someone here have the video? I want to show you a video that I think is very important for us to watch, please.
There are people lined up to get in here at 5:15 in the morning. Really? Yeah.
Goods also changed the corporate culture at Warner Lambert. He encouraged new ideas, created top-notch employee services, and vested the entire staff. In 1997, he hit pay dirt with a cholesterol-reducing drug called Lipitor. Lipitor became one of the fastest-growing drugs in history. Sales topped $2.2 billion in 1998, accounting for 21% of the company's profits.
Can you bet 12 to 15,000 people on a product that's in a pipeline and you're hoping is going to work and is going to save the company, and it turns out you were right, but that's a real crapshoot.
Yeah, but it's worth it. And life is a crapshoot. And you know, it's worth it. It worked. It's fun. If it hadn't worked, you'd be talking to somebody else now.
The company, when you came here, was a $9 billion company. Today it's a $60 billion company. That's a pretty good number on the resume.
Yeah, well, a lot of people, obviously it isn't a reflection of one person doing this. A lot of people have contributed to it, but it's a source of real satisfaction. Hi, Terry. How you doing?
Hi. So it's Mel's risk-taking spirit that pervades what we do today. So let me just finish by saying this. This is the passion of RONALD, LAUDER, and myself. As you may know, all of the overhead and all the basic expenses of ADDF are funded by the two of us, we and the LAUDER family. So every penny that you have invested in research goes directly to research. There is no other organization anywhere that does that. And that is why I am confident that we're going to get there. I know we're going to get there. And with the help of not only the people in this room, but these researchers who are doing work all over the world, we will win this. We must win this. And for all of you, thank you for coming. Thank you for your support. And thank you for being human. Thank you. God bless you.
Well, as many of you know, I'm Howard FILLIT, and I'm very proud to say I'm the founding executive director and chief science officer. Hey! Thank you. Thank you so much. And to start, I do want to thank Leonard and Ronald and the family for really establishing this wonderful organization and asking me to start it with them, and for all of their support for almost 20 years now. It's just been amazing what we've accomplished, and I say that with great humility, that I was enabled to be able to do be part of what we've done over these many years. I also want to give you a tidbit of my Mel Good story, and I have many of them, but one of the most memorable memories that I have, Leonard mentioned a drug that Mel was on, and Mel was a risk taker, and he wanted to take risk when he heard that he had Alzheimer's. And he was very unusual, especially a number of years ago when he was first diagnosed, in wanting to tell his story and to get out there and say, I have Alzheimer's, to tell the world. This is a prominent corporate executive. Most of people like him would be very private about their diagnosis. Mel wanted to get out there. He wanted to be our hero, and he became the hero for ADDF, our spokesperson, until he could no longer speak. Mel spoke at our events and became a spokesperson for Alzheimer's disease and for ADDF while he had Alzheimer's, and he would get up and say, I have Alzheimer's, to the world, which was very brave. And he wanted to take risk on drugs, and I'll never forget when Nancy and I and Mel flew on their jet to Scotland because there was a scientist there who thought that he had the drug for treating Alzheimer's. And whether or not it worked or not, it subsequently, unfortunately, failed in phase 3 clinical trials and all that. But Mel took that drug for many years, and maybe it did help him. It's hard to say. It did, okay. You know, I'm the scientist, so I like to see the data. But, you know, he was very brave about that, and it was amazing what he did. It's really, one of the things I just want to mention also today is that ADDF is changing, and 5 years ago, about 40% of our portfolio was clinical, and about 60% was preclinical research, chemistry, and things like that. Today, in 2017, about over 70% of our portfolio will be in the clinic. And we're moving even more towards funding even more clinical trials, much more. And the reason for that is not only the push from our board and from Ronald and Leonard to move in this direction, but also because now is the time. This is a uniquely human disease. We've cured animals with this disease 500 times, literally. Many of those experiments were funded by ADDF. We've learned so much about how Alzheimer's disease happens in humans, in test tubes, in animals, but we need to do the experiments and the research in humans. We need to do human research. And going forward, that's going to be the majority of what we're going to do. We're going to be innovative in doing clinical trials, and we're going to innovate in this field the way we have before. And I just want to really say how excited we all are at ADDF about being able to be here at a time when we're going to be testing drugs in humans, and we're going to get there. Now, one of the people that we've supported over the years and who I've known for many years is Robbie Brinton, and I'm just so proud to be here and be able to give this award to Robbie. You know, she and I started as youngins, and I think I'm a little bit older than her, but I've always felt like maybe it's because I was the doctor, and maybe it's because I was a little older, or maybe it's because I got into Alzheimer's a little earlier, but I always sort of had a mentoring feeling with Robbie as well as a collegial feeling with Robbie, and so I want to say I'm very, very proud to be able to give this award to Robbie because we've worked together for so many years, and we've given each other advice, I would say, so it's really been great. I want to tell a science story because science is so much about serendipity. And I don't know if people always hear science stories. The science story that we hear today about is really started in the 1960s, which was, I don't know, 50, 60 years ago. And it's somebody who's sitting next to Robbie, Bruce McEwen, who actually is the mentor to Robbie and I, he was involved, and there were other scientists at Rockefeller involved in birdsong. So the science story of today starts with birdsong. Now, you have to ask yourself when you're out there, birds every spring, and there's thousands of species of birds, and each species of bird has their own bird song. And the bird song is in their genes. And when they sing their bird song is during the mating season. So bird song is critical to the survival of the species, of that specific bird species. And what happens is that the birds develop the song in the spring, and usually it's about 5 or 7 notes. The males sing it. The females on the trees somewhere in this vicinity hear it. They're receptive to that specific few notes. And the birds get together and the species survives. How does that happen? So scientists started asking the question, how does this happen? And it must have something to do with hormones. And they discovered that every spring there were surges in estrogen in the brain, not in the ovaries, but in the brain of these birds. And in every bird species, the estrogen would turn on the genes for that specific bird song, and new brain cells would be born that would code for the bird song, and the males to sing the song and the females to be receptive for the song. And that began a field which we call the neurobiology of gonadal hormones, right? Estrogen and testosterone, and the effect of estrogen and testosterone on the brain. Today, we understand that this is what makes us different by gender. Women and men not only look different physically, but our brains are wired differently. That's called the genomic effect of estrogens and testosterone. And during menopause, for example, many women have changes in memory and emotion and so on that result from the dramatic decline in estrogens at that period. The serendipity comes here. Bruce was at Rockefeller. I was at Rockefeller in the 70s doing immunology, and I started the Alzheimer's clinic, as Leonard mentioned, in 1981 there. And one of the great things about Rockefeller, it was the first clinical research center in the United States in 1906 when Rockefeller started it. And what he wanted to do was bring doctors and scientists together to do clinical research at the Rockefeller University Hospital. He wanted to do human research. And so in that spirit, having started the Alzheimer's clinic there, our lab, which was actually the lab where DNA was discovered, invited Bruce's lab, where I had started some collaborations, including Robbie, over to Rounds one day. And we went around and we looked at the Alzheimer patients and we interviewed them, and then we sat back in the conference room. And Bruce, who is right here, Bruce said, "Howard, why don't you give those women estrogen?" And I had no idea where Bruce was coming from. I knew at the time that it was an era where osteoporosis had changed from a part of normal aging, little old women, to being recognized as a disease of old age that could be prevented by giving estrogen to women at the time of menopause. And basically we delved into this, and we started the clinical trial, which resulted in the first publication showing that estrogen might benefit women with postmenopausal women with Alzheimer's disease. And as I imagine Robbie is going to tell you, that was also one of the days when Robbie, as a laboratory scientist, and you often hear bench to the bedside, bedside to the bench, this was the perfect example because Robbie got exposed to the bedside, and she saw her first Alzheimer patient there. And it changed her career, and she's been working on it ever since, and combined this knowledge of the neurobiology of estrogen on the brain with her interest in this disease, Alzheimer's disease, which is more dominant in women. And so that's how we got here today. That's how we got here today. Robbie has embarked on a program of developing drugs that are based on this estrogen biology. ADDF has been supporting Robbie since 2005 with several grants. It started in a lab. It started in the mice. When it got to the point where we needed to start doing drug development and manufacturing and things like that, and intellectual property discussions, and methods of formulation and clinical trial design, all the things that are really complicated and needed to get a drug into humans and do a good study. Robbie and the ADDF team and other consultants that we recommended to Robbie and others that she found all got together to help Robbie shape this program to get it where it is today, which is a phase 2A clinical trial of allopregnanolone, which is essentially the derivative of one of the human hormones that naturally occurs in our bodies. And so it's a good example of how we can take advantage of our natural nature to develop drugs for Alzheimer's disease. Robbie is also rather unusual, I would say, or in a good way, because she's very diverse in her interests and her activities. She's got not just a very, very deep laboratory basic research, neurobiology background and knowledge, and an advocate of all of that, but also developed a terrific clinical perspective. And now she's also become a leader and is now the head of the Center for Neurosciences at the University of Arizona, a new position that she's taken on, having left the University of Southern California for many years. So it gives me goosebumps, really, to be able to give this presentation to Robbie. I have to tell you, I'm just so happy for you, Robbie, so please come up. Robbie, stay. Yeah.
Well, what an honor. Thank you, Howard, for that heartfelt introduction. I'm a little touched. It's like, oh. So thank you again so much for the honor of the Melvin Goods Prize for Excellence in Alzheimer's Drug Development. I'm honored to be among those who continued the legacy of Melvin Goods and his commitment to curing Alzheimer's disease. I also want to thank Nancy, who is that Olympian who carries that torch for Mel as he continues to struggle with Alzheimer's disease and holding the light to all of us as we go forward in this challenge, this endeavor that Leonard referred to, that we must win. Of course, as Howard mentioned, right, no one does this alone. It's a team sport. Curing Alzheimer's is a team sport, and I stand here on the shoulders of visionaries, the giants, visionaries and innovators, Leonard and Ronald and Howard. I stand on the shoulders of my sister, who has been my ardent supporter through thick and thin again, and who has given into my life 2 bundles of joy and brilliance, one of whom is here, Joe, and Larissa, who's also in the city. I have to say, personal story, as I was developing my scientific career in those days, many women had to choose between having children or having a successful career. And gratefully, I didn't have to make that choice because my twin sister, my identical twin sister, had 2 children, so my genetic code is out there. Thank you, Evie. So as we look back and forward in the struggle to win this battle, which we will win, I am awed and honored to be part of the ADDF family. And it is a family. As Howard mentioned, there's a deep commitment to each of the scientists who are part of this endeavor. I came to ADDF, as Howard mentioned, with what in those days people would have said was a crazy idea. We now call crazy innovative, but then it was crazy. And that crazy idea was that the degenerating brain could actually regenerate itself. And all of these ideas came into life, as Howard mentioned, when I was a postdoctoral fellow in Bruce's lab at Rockefeller. And the first was, as Howard mentioned, having the grand opportunity, the transformative opportunity to be in communication and connect with, as it turns out, women with Alzheimer's disease. And that was, as Howard said, a transformative moment in my scientific career. I switched from being completely and totally and utterly molecular and cellular to now being, wait a minute, my science has a purpose. My life has a purpose. And that is to understand why the brain develops Alzheimer's disease, and to take that understanding and to transform that understanding into cures. I was first touched by the woman that I spent a great deal of time with, and Dr. Rowena Ansbacher. And she was an Adlerian psychologist. And we would take long walks up and down the Rockefeller Esplanade, and she would tell me about the feuds between Adler and Jung and Freud, and on and on. And I was fascinated. And at the end of one of those long conversations, those long strolls together, I took her back to her room at the Rockefeller Hospital, and I bid her goodnight. And then I waited outside her door for 30 seconds. And I came back in, and I said, "Dr. Ansbacher, do you remember me?" And she was so lovely. She said, "No, I'm so sorry, should I?" She could not remember me for 30 seconds, and I've remembered her for 30 years. And that is the transformative power of the kinds of work that ADDF brings, of clinicians and scientists and human beings together, which is transformative. I would be remiss without mentioning Dr. Susanna Pedincheska from the National Institute on Aging, who has been a partner in this endeavor to bring therapeutics to life. Thank you, Susanna. When we were kind of dropped through the translational hole, we had worked with another one of the ADDF kind of members of the family, Larry Ruffolo, who had then moved on to NIH. And it turns out, I mean, he was great. I mean, you all knew how to do translational research, and Larry was going to bring this to us. And so I'd known Larry from ADDF, and now he was at NINDS, this institute. And we worked through this whole translational program, and he took it up to the leadership, and the leadership said, "I think not." So this was to develop allopregnanolone and to do many of the translational studies that were required by the FDA. Gratefully, Larry and Susanna are friends, and they're part of the ADDF network. And Larry referred me to Susanna, and Susanna called me and said, "Let's do it." And that together with ADDF, the NIA and the ADDF together, have been developing allopregnanolone as the first regenerative therapeutic for Alzheimer's disease. And I'm thrilled to say on Monday, we have finished the first 2 cohorts, dose cohorts in the study. We're on our 3rd and final dose. And gentlemen, I'm thrilled to say we got the last man in. It was a guy. It was a holdout, but we got him in. And I'm thrilled to say that we see very encouraging outcomes, very encouraging results from our first 2 dose cohorts. And obviously this requires much more testing, but we are on the right track. As Howard mentioned, a big part of my laboratory has been focused on why is it that the female brain is at greater risk for developing Alzheimer's disease. And again, that started at the emergence of ADDF and Howard and Bruce. And I was exposed to women with Alzheimer's disease. And I'm asking why? What is it about that brain? What is it about that brain that puts that brain at risk? And our second clinical trial, which has been completed, really addressed the role of estrogen, which I got to tell you, when I got to Bruce's lab, it was like, la, 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 I'm not going to listen to any of this steroid stuff. And, sure enough, I did. And so spent many years of our research trying to understand estrogen's action in the brain, and we ultimately developed an alternative to estrogen therapy in the brain that targets estrogen action in the brain to reduce the risk of developing Alzheimer's disease without promoting cancer in any of the other reproductive organs. So we have been quite successful, and again, it has been a team sport, and I'm thrilled that we are part of the ADDF family and now part of the Goods family. And look forward to many more years together. And quite frankly, what I'm really looking forward to, and it's coming very soon, together we will have the cure. Together. Thank you very much.
Thank you, Dr. Brinton. We are honored to have you as a recipient of the Goods Prize of Excellence. We wish you every success in the rest of your research and your clinical endeavors. My name is Michelle Goods McDonald. I am the middle child of my father's 3 children, most described as the charismatic and spirited sibling. And Melanie and David over there, now's a good time to bite your tongue. It's a privilege to speak to you today on behalf of the LAUDERs, my family, the Goods Prize of Excellence, and ADDF. Many of you here today were present at the 2010 ADDF Symposium Luncheon, where my father, Mel Goods, former CEO of Warner Lambert, was a guest speaker. The guests in attendance were inclined to believe that my father was speaking as a distinguished leader in the pharmaceutical industry. While he discussed the pharmaceutical industry and drug discovery, no one was prepared for what was going to follow next. My father shared his most recent doctor appointment, where he listened to the doctor as he said these words to him. "Mel, I'm sorry, you have early stages of Alzheimer's." And he replied, "But doc, I feel fine." I recall the audience's startled reaction so vividly. There were exasperating sighs of disbelief. My father's disclosure was an unexpected, bold, and courageous undertaking. Moreover, the optimism and positive demeanor that he exuded at this time is a genuine reflection of my father's character throughout his life, and even today, in the later stages of Alzheimer's. Acknowledgement and acceptance of Alzheimer's disease has come a long way in the last several decades. Most of you recall the 1981 Academy Award-winning movie On Golden Pond. On Golden Pond, starring Henry Fonda and Katharine Hepburn. The touching story of an elderly couple returning to their summer cottage, where the failing memory of Fonda's character reveals his senility. In one scene, Fonda can't find his way home, and the extreme distress on his face illustrated the reality of the struggles of early dementia. On Golden Pond was one of the first few movies to include dementia, although the word dementia was never even mentioned. Since then, there have been many films and public figures addressing Alzheimer's, which has increased public awareness and acceptance. The Notebook is a story of an elderly couple who were in love. He reads a story to her in the hopes that she will remember him, their children, and the happiness they had together. For a split moment, she remembers, and then the memory fades away. This is an example of how love still exists, but is suppressed by Alzheimer's. In the movie Still Alice, 2014, we see what it's like to have Alzheimer's from her perspective and those around her. We see the sadness, the struggles, and the efforts to hold on to her sense of self. Public figures such as Ronald Reagan, Rita Hayward, Charlton Heston, Charles Bronson, and most recently Glenn Campbell and his documentary have brought the needed attention to this debilitating disease. It has taken decades to go from calling memory loss as old age or senility to using the term Alzheimer's. All of this raising awareness is needed to increase funding and research to finally achieve our shared goals of curing this disease. And since 1 in 10 people age 65 and older has Alzheimer's, raising continued awareness is absolutely critical. While the focus of developing a cure for Alzheimer's is of utmost importance, it's not often that we hear about what an Alzheimer's diagnosis truly means to the family and to those near and dear. From the time of diagnosis, there is a measurable sadness and concern. How much time do we have left to communicate with him? What will it feel like for him? How long will he remember me? Will this happen to me? My family? The bond between people is based upon their shared experiences and being able to reflect on those experiences. With Alzheimer's, memories are stolen and the relationships we once knew broken. In the early stages of the disease, we cherish every moment in conversation. For a while, it seems fairly normal with occasional forgetfulness. But eventually, we realize that the moments of clarity are few and far between. We yearn for those magical moments. With my dad, even though he is physically here, he's not the man he once was. However, I have peace of mind in knowing that in the moment he is genuinely happy. The essence of who he is still remains. He has humor, kindness, and compassion for all of those around him. My young daughters cannot communicate with him in the traditional grandfather-granddaughter sense. Fortunately, they are able to see his true character through silly games, jokes, and songs. One of their favorite songs to sing together was the Chiquita Banana theme song. Amazingly, at that time, my father knew every word. My daughters joyfully shared singing with him, and I genuinely appreciated that my daughters experienced the core of who he is. While we relish in these special moments, how I wish my dad was truly present, that my children could experience the incredible man with all he had to offer. Our hope is that the Goods Prize of Excellence and the ongoing noble efforts of ADDF, that we will, and I will change that, must, find a cure to end Alzheimer's. Let's prevent future generations from having their memories stolen. Thank you so much for joining us here today. Thank you.
Today, a day truly about family. Michelle and Rachel and everyone from the Goods family, thank you. Can we have a round of applause for the Goods family? To the Lauders, Leonard, Ronald, Gary, thank you for your vision and thank you for throwing down the gauntlet. We will cure. We will cure. Thank you to the Lauders. And can we have one last round of applause for truly the star of the day, Dr. Robbie Brinton. And we think of Mel and we think of Nancy. And one last line from Nancy, which she called me with yesterday, is to say thank you to all of you, and I expect to see each and every one of you next year. Thank you and have a good day.